Hello and welcome to this webinar. My name's Peter Roberts and I'm the Director of the Emergency Department at Ryde Hospital, and I'm the Network Director for Critical Care for the Northern Sydney Local Health District. I'm the convener of the Critical Care Masters, and after these introductory comments I'll be handing over to Annette, Katelaris, who will go through some of the detail. Now, you're welcome to type in questions at any time, but we'll answer the questions at the end, and we'll hopefully answer all the questions. So I guess at about this point I'll hand over to Annette Katelaris.
Thank you very much for joining us today. I'm the Director of the Office of Postgraduate Education, and I'm going to give a content-heavy talk about the critical care degree. And part of the reason for that is that the handbook, unfortunately, isn't live on the websites yet, but should be soon. So, many of you might know that the University of Sydney Medical School offers a number of vocational degrees, and this is relevant for those of you who aren't completely committed to critical care yet, because there are some common stems that we can talk about later. Just to tell you a little bit about our courses in general, they're taught by leading academics as well as leading clinicians. And in particular, this critical care degree is taught by many of the people who run departments or are very important in anaesthetics, intensive care and emergency medicine in our major teaching hospitals. We're also presenting this in a blended learning environment. So most of the content will be delivered online with only some intensive face-to-face time, and I'll give you more details about that in a minute. The educational model we're using is fairly innovative, and we'll be delivering this course on a new learning management system called Canvas, which we hope will be a modern and interactive learning management system that will be easy for you to navigate. And we'll be using videos, podcasts, discussion boards, webinars, as well as interesting teaching experiences in a face-to-face environment. Some of you might have seen this pamphlet, which is on the website, and that gives you a nice snapshot of the degree and the subjects on offer, and that's on our critical care website. Just to give you an overview of how our units of study and degrees are structured, each unit of study is worth 6 credit points and runs over a semester, a 13-week semester. 4 units of study in that stream make up a graduate certificate. So if you want to only do a graduate certificate of critical care medicine, you need to study 4 subjects from the stream-specific subjects. And I'll give you more detail, but basically 6 subjects, graduate diploma, 8 subjects, master, and then if you've met the resolutions to apply for the advanced master, which involves doing very well in your subjects, you can complete an extra 12 units of study in a research project. So this is a busy slide, but it outlines what's required. So as I mentioned in the graduate certificate, to complete the graduate certificate in critical care, you can choose any 4 subjects that are stream specific. So any of these subjects here you can complete to complete a graduate certificate of critical care. If you want to increase that to the graduate diploma, you must also complete the introductory epidemiology unit and 1 other elective, be that a specific, stream-specific elective or a general elective. The Master of Medicine requires you to complete the core unit of intro epidemiology, as well as intro clinical epidemiology, as well as the capstone unit of evidence and ethics in practice, plus 6 other units that are either stream or general electives. So the overall structure of the master degree is as follows. Introduction to clinical epidemiology is common to many of our master programs. Evidence and ethics in practice, the capstone unit, is mostly stream specific, and both of those need to be completed to complete the master program. In addition, you must choose at least 3 stream specific units of study. There's then the option of completing 3 electives. They can be chosen from other stream-specific subjects or from our general electives. And I'll come back to that in a little bit more detail. But clinical epidemiology has been commissioned specifically for our master programs. And for those of you who are familiar with the public health degree, this is essentially an introductory epidemiology course for clinicians. And it's aimed at helping you interrogate and participate in the academic literature and teaching you the basics of understanding the literature and hopefully producing some yourself in the future. Importantly, it has been approved by the College of Emergency Medicine as meeting the 410 requirement, or the trainee research requirement of the college. This is the only unit of study that is offered face-to-face in daytime tutorials, or it is also available fully online. And there's some details about the assessment. This is also one of the subjects that is offered, and an unusual subject in that it's offered in semester 1 and semester 2. I've taken a number of inquiries from people who have completed part of a Master of Public Health or a Master of Medicine Clinical Epi. If you have done epidemiology methods and uses, you can credit that as an exemption to Introduction to Clinical Epidemiology, but you can't do both subjects. Now, the Capstone Unit is in 3 parts. The first part will be presented by our very prestigious Vellum Unit, Values and Ethics of Law in Medicine, and that will be about the ethics of research and practice. The second part will be about understanding the process of critical appraisal and understanding the key research and milestones that have informed the profession that you're entering. And the details again of the assessment and the face-to-face components are on the slide. Now, many of you are pre-primary and looking at ways to try and improve your chance of passing the primary examination. We've set up 4 units of study designed specifically at the primary examination of the College of Emergency Medicine, the College of Intensive Care Medicine and the Anaesthetic College. Now, we've also set it up so that it fits nicely into a year's study, depending on when you want to sit the primary examination. So if you want to sit the primary examination in the first half of 2016, you might study anatomy and pathology in semester 1 and physiology and pharmacology in semester 2. But if you want to sit it in the second part of 2016, you might come into the basic sciences in the second part of 2015 and start with physiology and pharmacology and then complete anatomy and pathology the following year. What's important is that these lots of 2 subjects have integrated curriculum. So when you're studying the heart in anatomy, you're also studying the heart in pathology, and the same with physiology and pharmacology. The anatomy subject is the only one of the basic sciences that has 3 face-to-face workshops. And they will be very valuable because you'll come into our very well-stocked, well-resourced Department of Anatomy in the Anderson Stewart building that many of you will be familiar with, and get a chance to reinforce your online learning with prosected specimens, with the museum and with models. Pathology, pharmacology and physiology will have a reduced amount of face-to-face time, but we'll have webinars where you'll be able to interact with our teachers. I guess for all you Harrison Fords out there, retrieval medicine is really a very exciting unit of study, and there are 2 of them. The first is the operational environment, which is a prerequisite for the semester 2 second subject in retrieval medicine, which is about clinical retrieval medicine. And we're very excited about these units of study. They're going to be delivered by Associate Professor Cliff Reid and Brian Burns, who are very senior people in this area in New South Wales and in the country. There are also some other stream-specific subjects which I imagine would be of particular interest to the anaesthetists out there. And some of you might have once enrolled in the Master of Medicine and Pain, and you still might do that, but you can now pick up some of these units and credit them to and use them towards a critical care degree. And we've chosen subjects that we think are highly relevant to your specialty. But there's a lot of information about these units of study on the website, and if you follow that link, you'll be able to learn about it. These 3 units are fully online. Communication, consent and ethics, we think is going to be an incredibly valuable unit for clinicians. And it's going to be a highly practical unit, and it's going to be delivered by people who are at the front line, dealing with crowded emergency rooms, dealing with busy operating theatres, who are trying to balance all the requirements of patients, patient carers, hospital systems, limited resources. And this will be a challenging unit, and one where you will come out, we hope, as a much better clinician. Then there are general electives, such as medical education and leadership. Leadership in particular, we've got a big storm going on here, so I apologise that you can hear the wind in the background. Leadership is going to be delivered by a senior lecturer from our School of Business, and it's going to resemble a unit of study that is taught into the MBA degree in Sydney. And this is an unusual approach to teach leadership in medicine, but we think it's going to be very exciting because it's going to be skills-based and taught by experts. Now, for your general electives, you can either choose things like medical education and leadership, or you can choose other critical care stream-specific units. So, for example, if you did the 4 basic sciences to pass the primary, but you really wanted to do retrieval medicine, you could pick up those 2 units as your general electives and credit them to and include them in your degree. You could also do other stream-specific units from other streams, such as metabolic health or paediatrics. I guess there's one unit of study that I would highly recommend to you, and it's a new unit that's been rolled out next year called Diabetes Management from Metabolic Health. That's been led by Professor Steve Twigg, who's head of the endocrinology department at Prince Alfred and holds a chair in endocrinology at the university. It's going to be a very high quality unit of study. Given that 1 in 4 patients admitted to hospitals in Australia now have diabetes, I guess I'm hoping that many of you will consider taking this unit of study as one of your general electives, because the endocrinology registrar is simply not going to be able to get to all your patients. Now, importantly, I just want to quickly run through our position with the colleges. First thing to say, and I'm delighted to say, as I did earlier, that Introduction to Clinical Epidemiology is now approved by the College of Emergency Medicine as fulfilling the trainee research requirement. We are hoping that our Capstone unit will attract the same status, but this is still under consideration by the college. As a contingency plan, you are able to take up Introductory Biostatistics, which is already approved by the College of Emergency Medicine. So if you enrolled in the degree and did Introduction to Clinical Epidemiology and did Introductory Biostatistics, you will have fulfilled the requirements of the trainee research requirement. The College of Anaesthetists has approved the degree for the Scholar Roll B, the Scholar Roll option B, provided that you complete the Introductory Clinical Epidemiology and the Capstone unit. The College of Emergency Medicine has approved the advanced option to fulfil the requirements of the formal project. So why would you do these degrees? We think you might do them to stand out from your peers. We all know it's a very crowded and competitive job market out there. We hope that this will help you meet college training requirements, as I've just outlined, and we're hoping it will prepare you for college examinations. I just want to emphasise that this is not a promise to pass the primary examination, but we think this will give you a very good grounding to attempt the primary examination. We also think that you'll gain insight from leaders in your field and you'll get to know them, and that you might broaden your skill base with things like clinical leadership and medical education. this is just some ideas of who might undertake this degree. So for those of you who want to prepare for the primary examination, you might start the degree, depending on what year you want to do it in, but you might start the degree by completing the 4 basic sciences, take 6 months out of the degree to finish your study and to sit the primary examination, then come back and complete your master degree. I've had a number of inquiries from people who've already passed their primary degree, and these people might want to complete the degree to develop their knowledge in specific areas, and that might be in things like retrieval medicine, which isn't yet, which is gaining in status in Australia, and I watch this space. I think this is going to become a much more important specialty in the next 10 years, and also things like pain medicine, and very importantly, develop their research knowledge and skills. And we've talked about broadening your skills as a clinician, and if you want to pursue research, I'd strongly recommend you aim to take up the advanced component so that you complete a research project, and hopefully you will be able to have that published if it's of sufficient merit. The other thing I alluded to earlier is that we do have a number of vocational degrees. And if you're a final year medical student or a PGY1, or you're junior in your career and you're not quite sure what you want to do, but you know you want to start something, you might choose to do introductory clinical epidemiology and 1 or 2 general electives, and then give yourself a year before you decide what stream you want to take. Now, for the university purposes, you will have to enrol in one of the degrees, but it will be relatively easy to change to most of the other vocational degrees. Run that by us before you commit, because there's some exceptions. I do want to just mention the international students. At the moment, this degree can only be studied outside of Australia. I also want to emphasise that this is not an alternative training path. This is not a way to get registered in Australia, and this is not a way to become an alternative training path for specialisation in Australia. We've taken many questions over the last few weeks, and many of them, and I'm going to just try and summarise some of them. One of the most common questions is, how many hours per week will I need to study for each unit? And the answer is about 10 hours per subject. The basic sciences in particular are very content rich. You know from your medical student days how much content you need to get through, and you knew that you probably had at least a year to study it. In this case, you will only have a matter of 13 weeks to study it, but for most of you it will be revision with a little bit of at a higher standard, but you should already know the basics. If you talk to anybody who has successfully sat these primary exams, I think most of them will tell you that they've spent at least a year killing themselves studying. So we think that you are going to spend about a year killing yourself studying these 4 basic sciences, and we're hoping to help you along with tuition and structure. But it will be a very full-on year if you do the 4 basic sciences in the year. Let me also emphasise that those 10 hours a week include face-to-face time and online assessment and study time. So we think that most students will undertake 1 to 2 units per semester. And remember, there is that advantage of doing 2 basic sciences at a time, because the curriculum of anatomy and pathology and of physiology and pharmacology are integrated. I've also been frequently asked, is there any fee assistance? The first thing to say is that there are no Commonwealth supported places, and I'm sorry about that. That was a battle I couldn't win. The second thing to say is that there is fee help. So you can, if you qualify, and we've given you the website to check, you may be able to put this on fee help so that you pay it back through the taxation system. What is the cost? The cost is $3,350 for a 13-week semester course, and the whole master degree without the advanced option costs $26,800, and you can do the maths for the graduate certificate and the graduate diploma. There have been a few inquiries from non-medical people. Those people would be applying for the Master of Science in Medicine. At this stage, we don't have any specific units that have been developed for non-doctors, but there are several units of study that would be of interest to non-doctors. In the future, we hope to add to our stream-specific units, particularly for people like paramedics and nurses. So within the next year, we hope to have some units that would interest those cohorts. In the meantime, if you are one of those people, you might again take up those general electives, just choose the stream-specific units that are of interest to you until those other units appear. But again, I can't make any promises about that. To enrol in the Master of Medicine, you need a medical degree. And this is a very complex slide that basically summarises the face-to-face components and the assessment. All these slides are already available on the website. They went up today. We're going to take questions now.